Hello, I'm Alicia Budd and I am an advanced orthoptist working in stroke care. Orthoptists are healthcare professionals which are experts in assessing those with neurological conditions affecting a person's vision or eye movements. We are part of the stroke multidisciplinary team and we assess stroke survivors to identify any visual problems. Around 2/3 of stroke survivors have a vision problem after a stroke, and signs of a vision problem can include not seeing things to one side of the person, bumping into objects especially to one side, leaving half their food on the plate, poor hand-eye coordination, poor balance and falls, closing of one eye and an eye that points in a different direction to the other eye. Stroke survivors may complain of symptoms of not seeing in one eye, difficulty reading, hallucinations, seeing two of the same thing, blurred vision, a lack of confidence when moving around, or they may have no symptoms of their vision problem at all. This presentation will describe and show you the most common problems you will encounter in stroke survivors, what you will see, and how during your daily interactions with these patients you can help them cope better with their vision problems whilst in hospital. A person's visual field is the area you see in front of you when you are looking straight ahead and not moving your eyes. A stroke survivor may experience visual field loss such as losing half or a quarter of their vision on the opposite side to the area of the brain where the stroke was located, i.e. on the same side as the weakness to the arms, face or legs. However, a stroke survivor could also lose part of their visual field with no other symptoms of a stroke. Visual field loss following a stroke will be present in both the person's left and right eye to the same side. A stroke survivor with visual field loss will usually be aware that there is a problem with their vision, but they may complain of losing vision in one eye as it may feel like this to them. For example, they may feel like the right eye is the problem when the problem is in both eyes to the right side. They may have difficulty reading and lose their place, and they may have visual hallucinations. They may not see objects that are placed on their affected side unless they move their eyes or head in that direction, and they may be startled if someone approaches them on the side of their vision loss. They may therefore bump into objects or people and are at risk of falls. If a person has visual field loss, many adjustments can be made and advice given in order to compensate for the loss. Notice how the person is startled when approached on their left side where their vision loss is. Instead, you should approach a patient on their non-vision loss side and then move to their affected side to encourage them to look around and scan their environment, which will help them to adapt. Removing clutter will help a person search for an item, and ensuring objects a patient will need, such as food, drink, phone, call bell and tablets, are on their non-affected side so they are not neglected or knocked over. As there is a risk of falls, ensure they get out of bed on their non-affected side and ensure there are no hazards on that side and their walking aids are visible. Give a person time to read or read information out to them. Following on from visual field loss, visual inattention or neglect is not being aware of things to one side of your body and the space around you to one side. The eyes may be able to see to that side, but the brain cannot process the images on the affected side. A stroke survivor may ignore things presented to them on the side, which is usually their left, and they may have reduced responses to any input on the affected side. This can range from mild to severe, and they may also have visual field loss to the same side at the same time. A stroke survivor with visual inattention usually will not realise that they are missing things to one side. They may feel they are seeing a complete picture, when in fact they may only be seeing half. Therefore, they may struggle more than those with visual field loss only, as they will not know to turn their head or eyes to search for the missing half. In severe cases, a person may be unable to look straight ahead, and they may keep their body turned away from the neglected side. They may only eat half their food on the plate, shave half of their face, or wash and dress half of their body, and they will not be aware that they have done this. Similarly to field loss, they will be startled if you approach them from the left side, However, they will not usually actively turn their eyes or head towards you and may talk looking straight ahead, unless you move to their unaffected side, whereas in visual field loss they may actively search for you when you speak to them. They will bump into objects or people and are at higher risk of falls. And as with visual field loss, minimising clutter will help a person search for an item. If a person neglects half their food, turn their plate around to ensure they have sufficient nutrition. Approach the person on their non-affected side so as not to startle them, and then move to their affected side to improve their awareness of the neglected side. If there are distractions around, attention to the affected side may be lost frequently, so this may need to be repeated often, and minimising external distractions may help. Reading will be particularly difficult, so reading out information for them will also help. And the risk of falls will be high, so ensure that they are helped out of their bed on their non-affected side, removing hazards and ensuring walking aids are visible for them. Ensuring the important items a person will need are on their non-affected side will help them to be found. A person will need to be often reminded to search for things on their affected side. As you can see, approaching a person to their right and handing them the spoon that they could not see enabled them to feed themselves. A person may experience visual hallucinations following significant vision loss, such as the case of visual field problems or visual inattention. It's not fully understood why this occurs, but it appears to be that when people lose their sight and their brain isn't receiving messages, it fills in the blanks with other images or past images, and a person may perceive them as real. It's described as being similar to a phantom limb, where someone has lost an arm or leg and still feels that it is there. Visual hallucinations are common after a stroke, but they are underreported as people may think they will be perceived as a mental health illness. A stroke survivor may experience more visual hallucinations when things are quiet around them or where the lighting is low. They may talk or interact with a person or object, and the hallucinations can be different for each person who has them, varying from patterns, people, animals or places, and they may seem very real to the person experiencing them and may be pleasant or frightening. Visual hallucinations will be on the same side as the vision loss. Hallucinations usually fade. They may take several weeks, but a stroke survivor experiencing these hallucinations can be reassured of this and reassured that it is not part of a mental illness but a side effect of vision loss. A person can be encouraged to adopt coping strategies when they see the hallucination, such as changing what they're doing at the time, closing and reopening their eyes, talking to or reaching out at the image, or telling others what they see. Hallucinations may not only be caused by visual impairment though. Infections causing delirium can present with hallucinations, and if there is any suspicion of infection, screening for this should occur. To find out more information regarding visual hallucinations, please make a note of this website. In order to have single vision, where we see one of each object, both of our eyes need to point in the same direction when looking at something or moving around. If there are issues with eye muscle control due to damage to the eye muscles, nerves or brain, or problem with the coordination of our eyes, a person may see two images of one object, either all the time or intermittently. They may also appear to have an eye turn or squint. A stroke survivor with an eye movement problem may not complain of seeing double. They may complain of blurred vision or knowing something is wrong but be unable to express what the problem is and may feel dizzy. When looking at a person with an eye movement problem, they may close or cover one eye at times, or it may be obvious that their eyes point in different directions, up, down, in, out, or a combination. A person may misjudge distances as their depth perception is affected. This may lead them to knock things over or have difficulty with steps or a change in gradient, and they may be more at risk of falls. If someone is having difficulty judging distances and knocking things over, decluttering the area will help, as it may be easier for them to pick out what they need to and encourage someone to take their time when reaching out for objects. If they're closing one eye frequently, an eye patch may help if there's double vision, and they may have had double vision or an eye turn before their stroke, and their glasses may help them with this to ensure that they are wearing them. Reduced vision is common for people in hospital due to multiple factors. Many people would usually wear glasses and may not have them with them. As a person ages, they're more likely to develop eye problems which may be present prior to them being admitted to hospital, or they may have been overdue a sight test. Certain illnesses and medications can cause reduced vision, and a stroke can also affect a person's central vision, causing it to be blurred. Blurred vision may be temporary or it may not resolve, and a person with reduced vision may complain of struggling to see things at near or distance or both. They may screw up or rub their eyes when looking at things. A person may struggle particularly when the light is dimmer or with objects of a similar colour to the background, i.e. a clear cup. They may be anxious moving around an unfamiliar location and they may be more at risk of falls. Many people will wear glasses which will help with blurred vision, and asking a family member to bring in a patient's most recent glasses may help. Labelling these with a person's name and what distance they should be worn for, and ensure that these are worn for the correct activity, for example for reading. Having a well-lit area around the bed, especially when reading, will help. However, ensure bright light and direct light is not positioned directly at the person to avoid glare. Contrasting the colour of the cups and crockery with the table or tray so a person can see these more easily will help someone struggling to see, and enlarging text on menus or leaflets and reducing clutter will also help. Hopefully you'll now be more aware of the vision problems encountered in stroke survivors, how they may present, and how best to help the person you are caring for. Vision problems are often a hidden disability after a stroke, and they can extend a person's stay in hospital, affecting their rehabilitation and nutrition as well as their experience. It is therefore important that the vision issue is identified by the orthoptist, and they are helped to cope better with the problem by the things that you can do to support them. Every interaction you may have with a person with a visual impairment can help them to adapt and make their stay in hospital less frightening. In summary, the main points to guide you are: if a person is struggling to see to one side, move things where they can see them and encourage them to look where they can't. If there are hallucinations related to a vision problem, reassure the person. If you suspect they have double vision, offer them a patch if they're closing one eye, misjudging distances, or if their eyes are looking in different directions. If they wear glasses, make sure they're worn and clean and there's good lighting. Ensure if there are any visual signs or symptoms, the patient has been referred to an orthoptist. And remember that all of this will support the patient with vision problems that is in your care.